Somewhere in your medical practice, between the minute a patient receives care and the day you actually get paid for it, there is a gap. Sometimes it is a minor delay. Often it is a massive operational blind spot. That gap lives in the complex space between your clinical staff and your insurance payers. It involves utilization reviews, where payers assess if care is appropriate, and the highly specific clinical documentation required to prove it. This chart tracks the initial claim denial rate across the healthcare industry. The trajectory is steep, hitting an 11.8% rejection rate in 2024. Practices are losing money they are legitimately owed for care they have already delivered. Payers are scrutinizing claims more aggressively than ever. They are specifically targeting medical necessity, rejecting claims because they decide the submitted clinical documentation does not sufficiently justify the level of care billed. Medical practices are bleeding revenue through a silent war of attrition. The problem persists because in most clinics, nobody truly owns the intricate, highly technical workflow required to translate clinical care into bulletproof payer documentation. The natural instinct is to blame aggressive payer tactics, but the actual bottleneck causing this revenue leak is the internal fragility of standard medical practice staffing models. Consider the front office. With a 40% annual turnover rate for support staff, medical practices are constantly rebuilding their teams. The vital, payer-specific institutional knowledge required to get claims approved simply vanishes every 2 years. When short-staffed billing teams are stretched to their limits, the immediate consequence is a backlog. Right now, 65% of all denied medical claims are never reworked. They are pushed aside because the remaining staff lack the bandwidth to fight the tear. Yet, the data shows that over 54% of those ignored claims could actually be overturned and collected. That is an enormous amount of recoverable capital sitting entirely dormant on your servers. Every denial comes with a strict deadline for an appeal. When staffing shortages cause your team to miss those narrow windows, temporary payer rejections harden into permanent structural revenue loss. To reclaim that lost margin, high-performing practices are leaving behind chaotic hiring cycles. Instead, they integrate a seamless external digital workflow to manage denial friction. Staffingly's Physician Advisory Services provide a dedicated team that handles the entire documentation and appeals workflow. It effectively removes the unpredictable staffing variable from your practice's denial equation entirely. A dedicated team of credentialed specialists plugs directly into your electronic medical record system, working your specific payer mix daily. Predictive AI tools augment the process. Smart Routing intercepts the workflow, automatically auditing documentation to catch missing details that trigger rejections. Embedding a credentialed AI-augmented team at the point of submission closes documentation gaps before they open. It shifts your practice's posture from reactive denial management to proactive prevention. The most common hesitation regarding external workflows is the fear of operational disruption. Staffingly solves this with a highly structured 14-day go-live timeline. Deployment begins immediately with a deep dive into your practice's specific payer mix and workflow preferences. Secure remote access to your EMR is established and verified within the first 48 hours. The infrastructure operates within a non-negotiable compliance framework. From day one, remote access is locked down through protocols that are fully HIPAA compliant, heavily encrypted, and aligned with rigorous SOC 2 Type 2, ISO 27001, and HIT Trust standards. Following the setup, the team enters a 14-day risk-free pilot phase. You receive weekly, transparent KPI dashboards tracking exactly how many cases are reviewed, turnaround times, and the direct impact on your revenue cycle. This secure, plug-and-play deployment immediately bypasses the exhausting 6-month learning curve that typically comes with training a brand new in-house billing hire. For medical practice owners, the decision ultimately comes down to acknowledging the mathematically unsustainable economics of traditional revenue cycle management. This scale shows the true burden of standard hiring. When you factor in base salary, payroll taxes, mandatory benefits, and the inevitable cost of turnover, a single, fully loaded in-house specialist costs your practice up to $84,000 every year. Contrast that heavy operational drag with Staffingly's model. You secure a dedicated, highly trained specialist working directly in your EMR for a flat rate of $399 per week. That lean structure scales instantly with your clinic's volume, and it locks in an aggregate operational error rate below 1%, a metric that currently protects the margins of over 800 medical practices. A 10% denial rate functions as a permanent leak in your practice's revenue cycle. Solving it requires moving past the constant cycle of hiring and training to install a dedicated structural asset. Book your 14-day risk-free pilot at staffingly.com today.